Life is a one-stop hearing healthcare center that focuses on diagnostic and management of hearing disorder. We offer a complete range of hearing products and solutions for both our adult and children. We strive to provide professional and personalized hearing services by our trained audiologists. Our goal is to promote hearing healthcare as a part of a healthy lifestyle, and our services include comprehensive hearing tests, hearing loss, tinnitus rehabilitation, and hearing aids related services such as prescription, fitting, tuning, servicing, and etc.
My name is Aliyah Shin. I'm founder and chief audiologist of Sound Life Hearing. I'm a believer of better hearing, better life. Living in a world of sound can definitely transform a person's lifestyle and personality.
In Sound Life, we are all certified audiologists, where we follow the best audiological practice in order to help our clients to rehabilitate their hearing-related difficulties. Sound Life Hearing was founded in 2016. All the operation management and clinical tasks are run by a team of passionate and qualified audiologists. We carry different brands of hearing aids and few other health products to fulfill the requirement and need of our clients.
We felt the most joy when we see the transformation of a patient's life. It's amazing to see how much joy one can achieve through better hearing.
My life is much better now with my new pair of hearing aids. I can FaceTime call to my children, and so much better than last time that I can't.
Of course, Sound Life was the one that actually helped me to improve my hearing. My hearing impairment improved tremendously, and I'm very satisfied with that.
Our mission is to provide hearing healthcare as a part of healthy lifestyle, to raise hearing awareness of the public, to remove stigma of the society towards the hearing impaired, and most importantly, to empower people who suffer from hearing loss to live to the fullest with the latest hearing aids or cochlear implants.
Here at Sound Life Hearing, we are focused not only helping you to hear better, we help you through all the aspects of your hearing health. If you have any questions about your hearing, contact us and schedule an appointment today.
Hi, good evening everyone. Welcome to Sound Life Hearing and also ASAP Spine Health Facebook Live. Today, we are going to share about Vertigo last series, which is a perspective from a chiropractor, how chiropractor can actually treat vertigo. Welcome. Hi, Kyle.
Hi, good evening, everyone.
Good evening.
Hi.
How are you?
Okay, not bad.
Okay. Can I just see who is actually online? Can you say hello to us? Tell us where you are coming from, and then now I'm sure that you are interested to know more about this vertigo causes and treatment. And actually, Sound Life have been running this event for few days since last Wednesday. We had our first live with ENT doctors, Dr. Gan from Columbia PJ. Then last Thursday is actually with our audiologist specialized in balance treatment, Dr. Shasha from Eartistic. And then last Friday was actually a TCM doctor, Dr. Sky from Sin Osteopathic. And tonight we have Kyle Lim to actually join us. So Kyle is also the founder and chiropractor from ASAP Spine and Health. So Kyle, do you mind to introduce yourself a bit more to the audience?
Sure. Right, so who am I? Here. So this is me. I'm a Gonstead chiropractor and the founder of Sept Spine and Health, actually. And I have certification of chiropractic degree. Okay, so I have certification on. Okay. Right, this is my team and they are also part of my family. So if you have any spine issue or vertigo issue or anything related to health, you can find us. Right, back to this. So vertigo, chiropractic can help them. A lot of people ask me about this. So what do you think, Elia?
I also wonder. When the first time you know that I am going to run this Vertigo series because of the balance week last September, right? So I'm going to invite few speakers to come and chat. So when I learned about chiropractor also can treat vertigo, I'm so interested about it lah. But I don't know how do you all help the vertigo patients? So do you mind to share a bit more?
Sure. Okay, everyone, don't mind me being a bit hey today. Okay, let's begin. So, what is chiropractic? Right? This is what we do. You see the Gonstead approach just now, right? I'm the Gonstead chiropractor. So, these 6 steps are what we do every single day. So, patient comes in, we ask about history, we ask about every single thing, and then we observe from the moment they step into our room, and then we'll see, oh, this fella here, meh, there, meh, okay, beard misaligned here and there. Okay, do you see this thing? This device. Okay, this device is to detect heat. What heat? So here, this is the nerves coming out. So when something, the bone is pinched against a nerve, here, pinch against a nerve right here, and it will go inflame. Swelling will occur, and then heat. We'll detect the heat using the scope. It's called nervoscope or delta T. And then we'll draw a line there, and then booyah, that's the place. And then all segments should move. Like every single thing should move. If one of them isn't moving, especially the line there, the swelling part, when I poke up, you'll be like, oh, pain. Yeah, then I know it's there. Can you
Okay.
open back my slides, please? Yes.
Kyle, do you mind to show that thing again? Because just now the video screen a bit lagged. Do you mind to show us again? I think
This one. This
Yep.
is the front part. This is the back part. Okay. So if anything happens, it will pinch against the nerve. So the nerve. Do you see this? Both nerves will come out from both sides. Then when
Okay.
it's pinched, then it's inflamed. Yes.
Okay, I see.
Yep.
All right. So for people who are actually interested to know more about tonight's topic, if you have question, if you suffer from vertigo, feel free to actually post your question under the comment box. Okay. Our audience are quite quiet today, so don't be shy. Post your questions, and then after this, we will have a Q&A session. And besides that, we also have some surprise for some of you. So do stay until the end of the live because we have something which is worth, I think it's like total worth is like more than 500 ringgit to be give to you all. All right.
Mhm.
So, yep. Kyle, so I have understand what you all do. So
Mhm.
how does it actually relate to our vertigo? I thought vertigo is a inner ear problem. Yeah, I know that also sometimes it's also is a central problem, but does it affect does it actually related to spine?
Yes, actually yes. I will talk further behind, but I'll give some sneak peek. Okay, our brain controls the whole body, correct? The nervous system and everything. So when cranial nerves, when nerves comes out, it will attach to every single part of the organs in your body, correct? So when the nerves is pinched, means current cannot flow, signal cannot flow. When signal can't flow to that part, and then you will be like, eh, why like that one? Even though our circuit, if it's not connected, the bulb wouldn't like light up, correct?
Yeah.
Same thing. So it's relatable, every single thing. But I will talk later on. Yep.
Okay. Sure. All right. So
Right.
let's see. Yep.
Yep. So after checking, we'll use the X-ray. We need to see the foundation, the level, everything. Does it go this way or this way or this way? It is very, very important to us. And then lastly, specific adjustment, of course. Okay. Yeah. And yes, we commonly treat every single thing that you see inside. And do you see the arrow there? Migraine, dizziness, vertigo. It's one of it.
I see.
Yeah.
So
A
are
lot of
you
people will
sure?
ask, are you sure or not? Okay, like from all the articles and all the websites, yes, chiropractic can help. See, if the problem is inner ear related, your chiropractor may perform what is called Epley's maneuver, and then to help reposition the bony particle inside the crystal, and
Yep.
then sometimes inner ear problems are due to C1, which is the upper cervical, right here, the problem right there. So,
I
yep.
see.
And we have also some articles that chiropractic management help patients with Meniere's disease. You see case reports suggest that chiropractic care, spinal manipulation, soft tissue therapy, beneficial to the person having this disease. And see, constant method helps with cervicogenic dizziness. It's not only vertigo, Meniere's or everything. It also helps with dizziness, headaches, and everything. Okay, and balance disorder because of the head and neck trauma, everything can be helped too. Okay, so how? Then people will ask, okay, Lord, you give me results, but you give me all the articles already, but how?
Yeah.
Okay, see, when, like I said just now, pinch nerve, like this, pinched nerve. Okay, like the slides just now. Okay, it's just like the hose being tangled. Water cannot come out. This is before adjustment, and other people will be saying like, "Aya, how do I know? How do you know? You find us, then you know." And then we will do some adjustment. We crack that bone only back to its place, and the bone start moving, and water flows out. Means smooth flowing nerve signals. Okay. Okay. So now we do treat that. Okay. We really do treat that.
Okay. All
Okay.
right. So are
Motion
these
sickness,
common
vertigo,
cause?
dizziness, Meniere syndrome, spine cause imbalance, are they all the same? Elia, do you think they are all the same?
Well, from my experience, motion sickness I used to suffer before because I have one history whereby I went to the
Elia, I can't
beach
hear
where
you.
the you can't hear me.
No, I can't hear
Uh,
you.
okay, can you hear me? How?
Okay, I can hear you right now.
Okay, so yeah, I was saying that I suffer from motion sickness before. So
Mhm.
what I understand is like sometimes we feel that the environment is moving.
Mhm.
Yeah, but vertigo is actually something different.
Yes.
Yeah.
Me myself, I suffer vertigo like since 3 years ago, I think. Yeah, very sudden.
Okay.
Yes. Can you hear me? You can hear me, right? Yes.
Yeah, I can hear you.
Like what Aliyah said just now, motion sickness is like you sit in the car, you feel wow, I cannot, very dizzy. I feel like puking. Vertigo is like not even though you are not moving, the whole place is spinning around. You're like, oh, I cannot. Even though you close your eyes, you still feel like you are spinning. Dizziness is like,
Yes.
yeah, okay lah. I get up, I feel like dizzy, but I still can walk, and you still can walk in a straight line. But vertigo, you cannot walk in a straight line. Do you see those people like drunk already? How they walk? This is exactly how you walk. Okay, even though you're not drunk. And
Yeah.
Meniere's syndrome. Okay, Meniere's syndrome. It's a syndrome, and vertigo is only one of it, right? And you might have tinnitus, you might have hearing loss, and some other stuff. And also, spine cause imbalance. Actually, my vertigo is due to my spine. I have a bad place misaligned that causes vertigo every single time when the signal is blocked. Yes, I
Okay.
kid a lot,
Was you
especially.
were you actually a chiropractor by then last time?
Hmm. Yes, I'm a chiropractor already and I'm practicing already. Why I had that, I don't have that last time. It's because someone like practiced on me. They accidentally adjusted. Okay, my C1 was like that. Actually, you should adjust it back like that. But the person adjust from this way and I became worse.
Okay. Oh my God, that is so dangerous. Okay.
Yes, and since then, I'm like, oh my god, I have vertigo already. and I hate that a lot. But every
Are
single
you
time,
okay now?
mm, if my spine is misaligned again due to working, then yes, I need help again. But as for now, I don't feel anything. I can
I see.
spin like that, but I still don't feel anything.
Okay, all right, understand.
So guys, they are not the same. Okay, because a lot of
Mm,
patients come in, hey, I got vertigo. Then I ask some questions. They are like, no, no, I don't have that one. Okay, that's dizziness. That's not vertigo.
mm,
That's totally different. Okay.
yep.
Yes. And yo, that's me. Do you see the lines? How sengit are the lines? Do you see my head
Okay.
tilting one side because of this? They
Yeah.
trust from this side to this side. Then I'm like, oh, even worse. And this is how it goes. You see, wrong foundation, sengit foundation. Everything on top will go sengit, just like me.
Okay.
That's bad. Okay, back to you. So vertigo. See, effects of vertigo is all those, but causes of vertigo is like the other things. Okay,
Mm.
back to you, Alia.
Okay, so just a recap for those who miss out our previous Vertigo series, live series. So here is the thing. Actually, our human balance system is made up for few system together so that we can have a very good balance system and we don't have the vertigo. So the brain actually integrate few information. One is actually from the eye, the vision, and then the other one is actually from the ear, which is the things that control over it is called vestibulum. And then we also have our balance system, which is the proprioception and also exterioceptions. So when you stand, you knew that now you are standing. And then if let's say you sit down, you also know that you are sitting down.
Mm.
So the whole thing, after we listen, the brain will actually make sense of the sound. Of course, as an audiologist, I focus more on the ear part.
Mm. And we
So
focus a lot on the spine part.
yeah, correct. So maybe I just use this chance to also explain a little bit about the ear parts.
Sure.
So this is our human ear, anatomy of the ear. Um, Kyle, I think your speaker may be a bit loud. I may mute it when I talk. Okay. So this is our human ear, and you can see that our human ear has really make up from three sections: the outer ear, the middle ear, and the inner ear. So usually for us to understand and hear sound, we our outer ear will actually collect the sound, and the sound travel up to the eardrum, and the eardrum will actually vibrate. After that, the vibration will send to the middle ear, whereby they are made up of three ossicles, the tiniest bone in our body. And then from there, the energy will amplify by 20 times. And then the mechanical energy will actually transit to the round window and then reach the cochlea. So from here, there is actually hydraulic, inside the cochlea, there is actually fluid. So depending what sound that you listen, the fluid will actually traverse and then send the signal to the brain. Like high pitch is at the apex. Sorry, the low pitch is at the apex, and then the high pitch is actually outer of the cochlea. So you can see behind the cochlea, actually there is a three parts, something like circular. So we call that semicircular canals. That is actually our balance system. We also call it vestibular system. And then after that, you can see that both of them are they are different nerve, but both of them are considered the same nerve, the eighth nerve. So the eighth nerve is actually made up of this vestibular nerve and also the auditory nerve. Okay. So one thing about our inner ear system is that there is a fluid inside the semicircular and also the fluid inside the cochlea. So both fluid is actually separate. However, if let's say something wrong goes to our inner ear, like some having swelling, so they mix up already. So for example, a person with the mania disease, later we will explain about it. Then the person will have like vertigo at the same time will also have these motions and also have some hearing problem, or sometimes they will have the tinnitus as well. Yep. So over here, just a very quick recap. For vertigo, we have peripheral vertigo, and we also have central vertigo. So for the peripheral vertigo, meaning to say that the vertigo problem is mainly arise from the outer part. Outer part meaning not the central nervous system. So it's actually from the ears problem. Like for example, we have a disease called this BPPV is the most common BPPV is the most common vertigo happen. So just now Carl also mentioned about his clinic can also do some assessment. Normally we use like this hot pipe assessment, and then we use the Apley maneuver to actually help the person to put the crystal back to the canals. Okay, then we also have something called rabiditis. So this one rheumatis and also the other one called vestibular neuritis. Both are actually inflammation happen inside the vestibular system. So either of them happen it, and if let's say the inflammation only happen to this vertigo, to the Ravenine, the semicirculars, then it won't actually affect the hearing part. The person will only present with the symptoms vertigo, but without hearing loss. But if the person having the inflammation is more parts that you can see, like Meniere disease, there is a fluid situation built up in the inner ears, so resulting in the vertigo present with the tinnitus and also the hearing loss. So this is we call it peripheral vertigo. Then what is actually central vertigo? Central vertigo can happen by any other sources, like for example, migraine, stroke, tumor, or multiple sclerosis. Okay, so this this central vertigo refer to the problem and where the central nervous system is having the issue lah. And it can be also sometimes arise from some other sensory as well. Like for example, a person smells something, suddenly the smell is too much already, or maybe the person is like too happy or too sad, then that can also trigger the central vertigo. So Kyle, so this is what I understand from an audiologist perspective about vertigo. So when you mentioned just now about this upper cervical that cause a vertigo, this is actually something new to me. And do you mind to explain a bit more? Wait, unmute first.
Okay. I don't know if you guys sprain your ankle before. When you sprain your ankle, our body is super intelligent. We have the thing called innate intelligence, right? When we sprain our ankle, body will send a lot of fluid, like the same fluid into the ear. Wait, when? Yep. Yes.
You are hanging. I think just now sometimes a bit hang, but it's okay. You can continue.
Can you hear me right now?
Yeah, we can hear you. So audience, if let's say you can't hear us, do text us because now we are using the StreamYard, and then we are not on Facebook, so we may not knowing that our audio system or the video having some issues. So do comment. So just a quick check with everyone. Is everyone hearing okay? If let's say you're hearing okay, can you just give me a okay? Okay. So we are waiting. Okay. So for those who are just logged in, tonight we are having a vertigo cause and treatment series, and then Sound Life Hearing is very fortunate and honored to invite Kyle Lim, which is a chiropractor and founder from ASAP Spine Health, to come over and share about how a chiropractic way can treat the vertigo from a chiropractor's perspective. So for those who miss out our earlier live, whereby we have a vertigo series together, interview with the ENT, with the audiologist specialized in the vestibular system, and also with the TCM doctor, feel free to actually go to Sound Life Hearing page and watch our past live as well. Okay. So from the comment, we don't hear anything. I think the audience is okay, just that they are busy. No time to.
Okay.
So let's continue.
So, yeah, same thing. Our body will send fluid there to protect our joint from being even serious surgeries. surgeries, but injuries. Okay,
So,
same
so
thing.
you are saying that if let's say we sprain our ankles, is it
Yes.
any
When we
parts of the body also lah?
Yes. Our wrist, our thumb, anything. Then you will go to doctor. Hey, my this part swelling. How? Then doctor should ask, do you have any trauma? Do you sprain it? Do you do anything? Then you will be, oh yeah, I sprained it and then it's painful right now. Yes, because this is our body's innate ability to help us and protect us. Same thing. From our perspective, if the nerve into the ear, the vestibular nerve and the cochlear nerve is injured, or the eighth cranial nerve is injured, signals cannot flow through there, correct? So when signals cannot flow, they thought, hey, I need to protect, something is wrong there. So slowly you will pile up a lot of fluid inside the ears, and then you cannot hear properly. Sometimes people come in, they will tell us, I don't know why one of my ear is like something is masking, I cannot hear properly. That is when, and that is why we will check your spine. We'll check your spine first, because later on I will show you some slides, and it's about the upper cervical. Upper cervical, when the C1 is having problem, it will pinch the nerves going into our vagus, which is the GI tract, the digestive tract, the ear, the throat, the sinus, every single thing. So it's quite important and quite intelligent somehow. Yes, that's what I
Okay.
can say. Yeah.
Okay. All right. So, all right. So, this is what I understand from the manual disease. All right. Usually, the left side is actually represent the healthy inner ear, whereby we don't see any inflammation or everything's all the pipe that connect to each other also small one. But on the right side, we can see that something in the middle around the cochlear part is actually built up already, right? So over here is built up, and we always say that it's like because the inner ear, the fluid is too much, the swelling is too much, and then the pressure is already off already because they suddenly have accumulated too much of fluid. So is that also this is something related to what you explained earlier?
Something like that. Yes.
Okay,
Falling.
and
Yes.
you are saying that it's also possible that the manual disease is actually due to the nerve cervical problem. That is why the nerve from the like for example, this is our inner ear, so our neck is here. So this problem is the one that having issue. That's why it affect this area that also having the inflammation. Is that
Could
am I
be.
correct?
Could be. I wouldn't say it's 100%, 200% confirm plus chalk, but yes, it might happen. Yes, we have a few cases that we really the okay EENT doctor said, you have Meniere's disease, and then you need to do this kind of treatment, that kind of treatment. Please do go and find someone who can help you, and then somehow someone referred the patient here, and then the patient told me, oh, I have Meniere syndrome. Then I say, how do you know you have Meniere syndrome? Oh, the doctor tell me one. So I'm like, okay, but do you have any other symptoms, or do you have any other like neck stiffness, headache, and whatever? Then the person said, yes, I have. And then sometimes I cannot hear also, one ear a bit masking like that, like a bit loss of hearing. I don't know how much, but loss of hearing. Okay, and the other one is I have headache also, one part of the eye. I'm like, okay. And then sometimes one part of the ear is having watery wax, earwax. I'm like, watery earwax. Okay, good. So
Is
I
that
asked,
because of the ear discharge? I mean, have you
maybe.
experienced the ear
Oh yeah.
discharge from the eardrum perforations?
Mm. I asked him, so is the oily earwax or the watery earwax is normal for you? Then the person said, no, mine is dry one. Then like, oh, do you knock your head somehow these few months or what? Then the person said, oh yeah, I fell down, but I'm not sure if I knocked my head or not. Then I'm like, okay, it's okay. We'll try to like the 6 steps just now. I tested every single thing and I found upper cervical and also pelvic problem.
Mm-hmm.
Okay, then I said, okay, right now, because over here it's very sensitive, I need you to go take an x-ray. Later on in my case, one of them is that person, and I will show you
Okay.
later.
Okay, sure. Let's continue your follow the next one.
Yeah. So this
Yeah.
is
So
your part, the audiogram part.
yeah, so sometimes we realize that because in Sound Life we often receive some referral from ENT doctors as well. So sometimes doctor will also already make their initial diagnosis, which is they suspect mania disease, and then present with the vertigo and also the tinnitus problem. But sometimes the vertigo is already stopped, not that bad. It's already get treated initial stage, but the patients just come here to do the hearing test. So we actually will do the test, and doctor will also use the test to differentiate whether the person is having like maybe rheumatitis or vestibular neuritis compared to having this mania disease lah. So often we realize that for mania disease, this is a hearing test report. We get the person, the hearing is slightly more blocked on they were present with the blocked ear sensation and also low frequency hearing loss. So as you can see over here, the normal range is 20 and below, but the person which is blue color one is their left ear is actually below the reading is like 45, 50, 40, 50 like that. So this one is a low frequency hearing loss, sensory neural hearing loss. So if let's say the mania disease no more, sometimes our body can also heal back. The membrane can form back, and then the pressure somehow they can go back to normal. So the hearing loss may gone back to normal as well. So yeah, but it not always come with this kind of hearing problem. It may come differently as well. Yep.
I see. So find one day I need to do this as well.
Yeah.
Okay. So let me tell you a bit about chiropractic history. Okay, a bit. Why do you tell me this? I don't want to know this. But Harvey Lillards came in. Okay, the person is deaf for like 17 years because the person accidentally injured the spine while mopping in the storeroom, I think. Then knocked the head, and then suddenly cannot hear slowly, and then all the way like become deaf straight away. That time, the person right here, this one, Didi Palmer, he's experimenting about bones, structures, joints, and everything. And then he's like, I think if I move the joint, somehow the nerve will get unstuck, and then lesser inflammation, then the signal flows fluently. Maybe I could help that person. So somehow he met Harvey Lillard and then say, okay, come, I help you treat. I help you check what's the problem. So he adjusted the upper cervical, the C1, and then boom, slowly, Harvey Lillard said, I can hear things already right now. Ui. And this person is the first case, like first adjustment ever. And yeah, this month is also World Spine Day, which is the first treatment that Didi Palmer adjusted, the first adjustment. So,
When was that? The history.
it was like 1897.
Wow,
1897.
I never know that the chiropractic is having even longer history than audiology. Our audiology is only emerged after World War II.
Okay. Because all
Yeah,
the rifle and everything, they boom the ears, they cannot hear
yeah, a
already.
lot of people present with the tinnitus and the hearing loss afterwards. Yep.
I see. So after that, then he slowly realized, adjusting the spine can help with a lot of things. Then slowly becomes like what we are doing right now. A deaf become no deaf. I'm like, ooh, my
Okay.
first time. So spinal misalignment, like really, spinal misalignment will cause all these things. Really, a lot of people cannot understand at all. It's like, cannot be lah. It's like I adjust then it will go back. Then no spinal like impingement, mana calling. Then
Sorry,
I'm
no
like,
spine what? Because just now your line cut off a little bit.
no spine impingement, nothing happening here. After one
Okay.
adjustment, cannot be.
Yeah.
A lot of people ask me, right?
Yeah.
So it's memang like that. And
Mm.
for the few webinars or talk you had like last week and few days ago, a lot of people talk about their perspective from ENT doctor, from TCM doctor, and from audiologist itself. They
Yep.
have different perspective, and yes, they are correct. They are not wrong. They are correct. And
Yeah.
we have our perspective also, and we do help a lot of vertigo patients also. So one thing they did not mention is upper cervical misalignment. Where is upper cervical? Yeah. Okay, so this is your spine. The whole
Okay.
spine. Upper cervical is right here on top. So this is the base of the skull, which is right here. And this one. These few chunks right here is the upper cervical. The C1, C2, and the C0. C0.
Okay.
Okay. Okay. And see the slides. Okay. Do you see the nerves coming out from the spinal cord itself? It attached
Yes.
to every single part of our body. Do you see that? And even the neck itself. And this one, they didn't draw everything to the top here, but yes, it goes to all the face also. And
Okay.
it is very important. Therefore, an adjustment reduce the nerve impingement. It will have more water flowing. Yes, the signal flows fluently again. So it is possible. And just now, what I mentioned about the foundation. Okay, do you see when this foundation is not good, everything on top will be like sengit, like that.
Mm.
Same like the X-ray right here. If the foundation is not in this level, everything on top they will start to compensate. Like if you build something right here, it's sengit like that. Cannot be you walk like that, mouth right. So
Yeah.
everything on top will try to compensate back in a very huge manner, and
Mm.
it will start to pinch against some of the nerve. So it
Mm.
is very important for us. Okay, now do you see this C1? Okay,
Mm.
and this is the brain and the brain stem, and it attached with the and it attached with the spinal cord right here.
Okay.
So if anything happens here, okay, the nerve will get pinched,
Mm.
and it's either pain or swelling or heat or redness, whatever it will come out. Depends on how severe it is. Okay, and here, do you see this person
Mm-hmm.
like me saying it? Okay,
Mm-hmm.
so when something is off, do you see that this part right here is more yellowish compared to the normal red color right here?
Yeah, and
And
enlarge
do
it.
you yes, and do you see this red color thing right here?
Mm-hmm.
Okay, this is where the brain stem is hit by the bone and something is going on. Something is off.
Okay, hit by the bone.
Here, yeah. This C1 right here, this bone.
Okay.
Do you see that? That's
Yeah.
why the whole head is tilted to one side.
Yes. You can see
Yes.
it's a very
Yeah,
not straight. Yeah.
correct. So if normal bone like that, it's
Mm-hmm.
straight, signals will flow through downwards perfectly. See,
Mm.
when brain health and healing messages can flow to all parts of the body without interference, the body has the
Mm-hmm.
natural ability to regain and maintain optimal health, which is what I said just now, the innate ability to heal. So when something is like that, it will be like, yeah, Bangkok already. Then
Mm-hmm.
cannot flow fluently, especially this part. This is called body imbalance and also what we call spinal misalignments. When brain health and healing messages cannot flow to all parts of the body due to interference right here at the point where
Mm-hmm.
head and neck join, this part, upper cervical, you may expect health problems to develop. And in this case, it will affect brainstem, and brainstem, it will have like some effectiveness about the cranial nerve, about your tongue deviation, your hearing, your swallowing, a lot
And
of
sleep
things.
as well, right?
Sleep, pain, anxiety,
Migraine.
depression, yes,
Oh my
bloating
god.
on the stomach,
I'm so worried. I actually have very straight neck.
yes,
Okay.
that
Okay, talk
kind of
about this later.
sure. Okay, and yeah, this is what I said about just now. Do you see
Mm,
all the nerves are coming out from here?
wow.
We will be talking about this, the eighth cranial nerve, the vestibulocochlear, the nerve
Mm,
that goes to the inner ear, like what you said just now, and
mm,
also vagus nerve. This is the other big thing.
mm,
It is super duper important. So please, guys, do not do anything stupid that you will hurt the brain and whatever. Yes. So this one it's a bit confusing, but anyhow, I will tell you. Our neck and our low back, it's called parasympathetic, and our whole back region, the thoracic region, and the lumbar, it's sympathetic. Sympathetic means fight or flight. Parasympathetic means rest and digest. So when something is pinched against the nerve, okay, body signal cannot flow through, and then your body will encounter something about oh, hey, why you don't want to let me rest one ah? What
mm,
is happening? So sympathetic will flow even more. Do you
mm.
understand it? Because
Yes.
one part is not good, the other part will come and do the work. That's
I
why
see.
when parasympathetic have problem, you will encounter something like pain producing, muscle contract even harder, and then increase of the gland secretion. Means when something is wrong up here or down there, maybe you have watery sinus. Maybe you have the ear, the ear inside the watery ear wax. Okay,
Mm,
and inflammation that there is a lot of fluid gathered onto the inner ear part, and
I see.
saliva a lot, and then a lot of HCl means the gastric juice. All this will happen, and then they will increase a lot of speed because when you are resting, your body is like, okay, I need to do work for you, and also parasympathetic can help in anti-inflammation. So if this one is shut off, it's shut down already, you cannot like when body is inflamed, you cannot cover it, you cannot stop it. So the inflammation process will go even more and more and more.
Mm-hmm.
This is what's happening inside. I hope I don't confuse you all.
Okay,
So
I need some time to a bit to digest it a bit. So maybe
yeah,
go back a little bit. So do you mean that like just now you mentioned one symptoms like what your patient experienced? He has a dry wax, but suddenly he had this wax change to wet one. It could be also because the parasympathetic is actually doing the job lah. Increase
it's
because it increase
not
the out
doing the job.
or not doing the job. I see.
Mm-mm-mm.
So something is like already out of the norm
Yes.
performance that.
Mm-mm.
So does it mean that if someone also increase very sweating too much, like those like women after they reach the menopause, then they sweat a lot. All this also because of this system is having
No,
problem.
no, no. Yes and no. That one a bit different because the female hormone is already like bye bye, say goodbye to
Uh-huh.
you, and the other parts of the body is encountering some other types of how to say signals imbalances, and then this one
Okay.
a lot of like doctor also will tell you, yeah, menopause is like that one. Your body is going through a change. So yes, yeah. When
Right.
hormones in your body is chaos, very chaotic already, your whole body will be like, I don't know what to do right now.
Mm.
So something will flare up, something will go missing, and then it will come down slowly, like really
Okay.
slow. That's why they say when you have hot flashes, it will go away after 2 years or maybe
Mm.
1 year or so because your body is adapting.
I
Yeah,
see.
with it. Yes,
Okay.
it's
Let's
quite complicated.
Okay, come back to
Right.
vertigo.
Mm. So C0 to C2, putting nerve pressure on the eighth cranial nerve. Okay, when you have upper cervical misalignment. We covered this just now. I want you guys to see about here, the inner ear. Okay, because when something happens, inner ear will inflame. When inner ear inflame, it's just what I said just now. Why Mo Tun Tun inflame out of sudden, out of nowhere? Because something is happening. Okay,
Mm.
it's either your body hurt, your body feel that, oh, I need to protect this part because of some injury, whereby there is no injury. It's just because of the nerve. They cannot flow. They cannot receive the signal. Sometimes it's really due to bacteria, virus, and everything. It will also cause inflammation. That's why in the beginning I said there is no 100% confirmed cast chop that your bone, your joint did some injuries to the nerve. That's why when you come in, we need to take history. We need to do some tests on you to check
Mm.
whether it's really the bone causing or it's other things. Okay. Yeah. Yeah. When inner ears is inflamed, there will be like swelling, and then semicircular canals is constricted inside because semicircular, like just now what you say, these three things, it's for movement.
Yep.
When something is wrong, movement is wrong. Vertigo will come. Correct? And cochlea, why hearing loss? Because cochlea is inflamed too, and it's responsible for hearing. Okay, and there is few nerves. Therefore, some people will say, hey, is my vertigo due to my jaw misalignment? Yes, maybe, because there is something called trigeminal nerve. Because here, you see that? The facial nerve?
Mm.
It's
Yeah,
also
facial nerve.
connected from here, yes. And then if something
Yep.
is wrong on the jaw, around the jaw, it's pinching also against the nerve. It will cause like paralysis, or Bell's palsy, or numbness going down. Yes, it's all like everything is connected.
Okay.
Yes, and swelling of the inner ear, um, the semicircular canals, these three things, it will constrict because of the parasympathetic involvement.
Mm-hmm.
Okay, when you are scared, sympathetic comes. You will hear a lot of things, correct? Because it's dilated. If you are sleeping, you couldn't hear a lot of things already. It's masked already because it's like constrict. So that's what's happening inside. Okay, and one thing we can do also when patient comes in is like, hey, put your head in between your legs like that, and then suddenly get up fast one. See if you are spinning or not. If you have all those like you cannot lie on the one side and the head tilting, like when you walk you are like senged to one side and you feel like sinking down, that is a positive. And some people will say then like what I said just now, people come in and then they say, oh, I have vertigo, but actually after testing it's not, it's dizziness. So dizziness when you bend like that, it's not caused by, yes, the problems below it. Okay, and yep, all this will cause dizziness, every single thing. That's why
That's a lot.
when we say misaligned jaws, we need to check also. Your misaligned jaws is giving you dizziness or vertigo or anything. Sometimes if you don't, like after eating sugar, like too much sugar, you feel a bit dizzy also. And some pregnancy, you will have dizziness also. Okay, because the hormones. And then eye strain. Sometimes one of the eye a bit strenuous, and then you will feel like, oh, everything is like blur blur, and then you feel dizzy. So every single thing will cause. But is it vertigo or not? Is vertigo? Is dizziness? We need to check. Don't
Okay.
simply say you got vertigo. It's different.
Yeah.
Yes. And now TMJ. TMJ is the jaw. Okay. TMJ misalignment, like what I showed you just now. See, do you see the nerves from here? It will go down to the jaw, this part, and your head. So sometimes jaw misalignment will cause headache too because of the V1.
Yep.
Yep.
Mm.
Every single thing, the vagus nerve as well. So bloating of stomach, some people will say, I don't know why bloating of stomach, then suddenly I feel dizziness. This is also one of the causation.
Wow. Okay.
Yes, this is a
Never
more,
think the stomach and the dizziness is linked together.
you will hear from some aunties.
Okay.
Stomach
I,
pain
I knew that
already.
for myself, if let's say sometimes I don't eat on time, so maybe it's like a lot of sugar. You know, like when we run clinic, sometimes patients or our consultation drag too long, then it's like didn't eat on time. So I will feel a bit dizzy, but I thought that one is due to blood sugar drop already.
That blood sugar drop will also cause dizziness. It's not
Mm.
an absolute answer, but it might be like from all the things right here. That's
Mm.
why I say I cannot confirm plus chop say that you confirm got this, you confirm got that. We cannot
Okay.
say that because we
Yep.
don't know. We still
Okay.
need ENT doctors to rule in and rule out everything. We still need audiologists to rule in and rule out everything. So everyone actually should collab together to check what's happening to that person and give a proper care. Correct?
Correct.
So see, if C1 and C2 is having problem, TMJ will also cause it, and then some disorder will also happen to the nerve, to every single thing. This one is a bit long,
Technical.
a bit complicated. Yeah,
Okay.
this
Yeah.
is what I want to tell. It's all connected. So now,
Okay.
yay, case study.
Yeah, I think this case study will be more interesting.
Mm,
Before that, for those who, if let's say you find this video helpful, please do share to some of your friends or share to your page, to the groups that you have, so that more people can be beneficial from this talk as well. Yep. And then those who share, and then later when you WhatsApp us, we do have some gift for you. So we would like to see that you have shared our video as well. Thank you. Yeah, continue, Kyle.
all right. Abnormal curve. Okay, this is one of my patient. Do you see? This is
Okay.
the normal curve. This one is the normal curve. The face is right here. This is normal curve. Do you see like big difference? Straight up already, the neck is like Bangkok like that.
Yep.
Don't have good alignment like this one. Do you see
Mm-hmm.
that? Okay. So please,
Mm-hmm.
everyone, look at this because I will not put this up later on, but I will just show cases. Come on. First case. Miss Gan right here. Okay, when she comes in, she's like, wow, I have vertigo since 10 plus years ago. It's like my friend already. Every time when I have this attack, I need to eat medication. That's all. And then go to sleep, cannot work. And then she also said that her stomach is bad. And every time when the stomach have issues, vertigo is even more. Then I'm like, are you sure this is vertigo? But she said, yeah, well, when I stand up, I feel sengit. When I walk sengit. And then sometimes I have the tinnitus ringing also. Then I'm like, oh, okay, it's okay. Let's check. Okay. Do you see the 4 lines right here? Okay. Do you see these 4 lines?
Mm-hmm.
Actually, these 4 lines should be parallel to each other. Do you see that the open wedge is on the, okay, we see x-ray like that. It's different from medical doctors. Left side is left side, right side is right side because I see patients from behind. This is what we see. Okay.
Okay.
So the right side is all opening like that, the wedge. Then you can know, oh, this person, the head is tilted a bit, and then the nerves on the right side, it's quite bad. Then after seeing this and also refer back to the history, she also said that when I lie on the right side, I feel dizzy. But when I lie on the left side, I feel okay. Okay.
Mm.
So everything it's pinching on the right side. And for her, the neck is super bad. That's why I need to do something below first to stabilize every single thing and only work upwards. But before I even touch the upper cervical area right here, when I adjust something right here, her vertigo start to reduce by quite a lot. At least she told me that, hey, Kyle, I don't need to eat medication already. Like, it's just like once a while, a bit, and then it went away.
I see.
And I'm
That
like,
is a good
good.
successful case.
Yes,
Okay.
because of the pelvic, do you see a bit sengat also, not too bad. But
Mm-mm.
when I corrected right here, everything on top start to compensate back.
Mm.
Mm. She's still in our care right now, but vertigo, I don't hear her say it anymore. Just a bit of stomach issue, which I referred her to see someone already. Yeah,
Mm.
a medical doctor.
Okay.
And case two, Miss Chung. Okay, this case a bit cute. Why? She has motion sickness.
Okay.
Motion sickness. Okay. Then I'm like, since when? She said, since young. Okay, since young. Then I write it down. Okay. So when I tested her, especially when I want to adjust her pelvic, do you see I don't know if you can see, the big and small lubang right here? Means the pelvic is disoriented. Okay.
Oh.
So after adjusting, before adjusting her, I asked her to lie sideways. Then she told me, sorry, doctor, I cannot lie sideways. Oh." Then I asked her why. I thought you got motion sickness only. Why cannot lie sideways? How about the other side? Then she also said, I cannot lie on the other side also. Then I'm like, why? Then she
Then he
said,
must be uh, sleeping very straight then.
yes, she need to sleep very, very straight. Even like when you sleep until half, you tilt, and then she
Yeah.
will wake. I said, why? Do you feel dizzy? Then she said, no, 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 I don't feel dizzy. Only during when I'm in the car or when I'm on a boat, only I feel dizzy. Then I said, why you cannot sleep sideways? Then she said, because very pain. Huh? Very pain, ah? Which side? Then she told me these two sides, just below the ear. She said, here very pain. The pain is like, I cannot tahan. Yeah, I'm like, okay, come have a seat. Then I spoke up. I recheck because
Okay.
the X-ray right here doesn't seem like a big problem to me. That's why I will try to stabilize her foundation first. But when I draw this one, do you see this line? Like really
Yeah.
hanging to the right. Okay, when you see this, can you see the line is straight?
Mm-hmm.
This is a C2 line. But look back on her case. You see like it's way on the right side.
Okay. I think
It's
you
not
are a bit tough to ask a non chiropractor to see all this. Maybe our
okay.
audience also confused. Yeah.
Yeah, just compare with this one. This
But
is a straight
normally
line.
it's straight line. It's supposed to be straight.
Normally,
So the other
normally it's
one
straight.
is like a bit sanged like that.
Then this one is like that.
Yeah. Okay.
Okay. This means that the bone went this way, like quite a lot. Cool.
You hold on. I must. You show again the
Okay,
thing.
normally it's straight, right? For her
Uh-huh.
case, it's like that already. Then the head is still upright like that one, but the neck is like that. That's why when she lies sideways, it's a lot of pressure around the lower ear area because
Okay.
of the torsion, the big torsion. So I'm like, okay, I adjust her first. I bring back the bone from right side to left side. Big clunk, like big clunk. Then I
Okay.
asked her to walk around. And then I said, might have some miracles. Huh? Okay. Then I asked her, you try to lie on your sideways and see. When she lie down, she's like, hui, no pain already. Then I'm like,
Okay.
good. Good for
Okay.
you. Then only I start adjusting other things. And when she came back that day, during the third visit, I asked about her motion sickness. She said, better a bit, but still there. I said, it's normal because it's there for like so many years already. Take it slow. Maybe it will go completely gone. Maybe it is still there, because sometimes when nerve is injured for too long, you cannot like really say missing, then like really completely heal, then completely heal. It's not so easy. I hope you understand me.
Yeah, yeah, understand for this part. So meaning to say that chiropractor, I mean, sometimes if let's say the dizziness or motion sickness and also the vertigo is linked to the spine problem, then you all can fix it lah.
Hmm.
Not all the
When
vertigo case lah, right?
But not all. Yes, correct.
Yeah. Okay.
I do have some cases that is not healed at all, and when they went to ENT doctor, they said something is wrong inside the brain. That's the
That
one
is
I
a
cannot help.
central vertigo lah.
That one I cannot
Central
help.
vertigo.
Yes.
Okay. So over here, just to let all the audience know here, I mean, Sound Life is doing all series of this balance life series that we invited the ENT, the chiropractor, the audiologist who specialize in the vestibular management, which is a called balance management, and also the TCM doctor to share about the way of like your treatments, different treatments from different health professionals. The reason here is we wanted to give an overview to an audience because we realized that there is a lot of mismatched information, and sometimes people just thought that, oh, we can only do this way, but they forgot the other health professional treatment may also help their condition. So that's why we do this kind of live series. So if let's say you miss out certain of our live series, feel free to go to our Sound Life Hearing page and watch back the past live as well. But one thing over here is want to say, actually Sound Life didn't treat balance problem at all. So for any balance problem, you can come to us, but we will still refer you out. Yeah, we might refer to you to the ENT or to the audiologist who special in this way. We are doing all this live series because it's actually related to audiology, number one, and number two is that we just wanted to help the public and we want to share the knowledge lah. Okay, yeah, okay, continue. Sorry to interrupt. Hi.
Yeah, it's okay. Let me think about one case that I referred a patient to you. Remember?
Yeah,
That
yeah.
that patient is having hearing loss, and then I said, okay, I checked something. You have something going on with your lower neck. It's not the upper neck. Then I said, okay, let's try. He had a major bone spur around there, and disc. The disc is really like left like that. Left like that. And then I say, okay, let's try. Give me 4 visits. Let's try. Everything else is better except the hearing loss.
Yeah.
Okay. Yeah, I say, okay, I know a person, I know a audiologist. Please do go to her. And then somehow he went lah. Then the
Yeah.
story, I don't know because it's not here anymore.
Yeah. No,
Not
I mean, just continue. Actually, the patient came, so we realized that the patient is having some sensory hearing loss, meaning the hearing loss because the patient also around 60 plus, so the hearing loss is due to the inner ear damage or degeneration. Normally, aging is a main contributor for a person who suffer from hearing loss, aging. So, and then we let him try the hearing aids. He felt beneficial to listen to us after wearing the hearing aids. Just like all of us, when you wear the spec, then you see your world clearer. But the thing is like he's not ready for it. So after that, he had gone through our 7 days hearing aid trial program, but after that, he's still not interested to continue. So he just returned the things to us. So if for those who have hearing problem, here small advertisements using ASAP slot. So if let's say you have hearing problem, feel free to visit Sound Life. We do offer 7 days free hearing aid trial. And normally during the first visit, we will do the test, explain the result, and then let you try at least like 2 hearing aids. Then you can choose the hearing aid to bring home for 7 days trial. After that, if let's say you find it useful, then you can proceed to purchase. But if let's say you don't find it useful, you can always return to us, and then we will see you 1 year later for the annual review. That's it. Yeah. So, but we encourage those who have hearing problem, it's better for you to take to how to say treat it early, because hearing not only related to hear communication, but also related to our brain health as well. A person who have hearing loss, you left untreated for too long, is higher risk to get dementia or Alzheimer's. Okay, that's all. Thank you. Okay, back to you, Carl.
Yeah,
How
that's why I
how
wanted
many
to
tips
say.
more you want to share?
That's why I wanted to say we need to collab together within all types of professionals. Okay,
Yes,
the second last one,
multidisciplinary.
Miss
Yep.
Chang. Okay, do you see this big open gap here? This one is still okay, but this one, what? This is a big open gap. When she came in like that. I'm like, Miss Chang, I'm down here. Why do you come in like that? Then she said, I cannot look down. When I look down, I cannot. Very dizzy, very, very dizzy. I will like straight away collapse. That type of
Okay.
dizziness. I'm like, wow. That's why when you see the X-ray right here, she's tilting up also.
Mm.
Yes. Then I checked every single thing. This one is a bit different. I straight away adjusted this bone right here.
Mm-hmm.
And then after one treatment, she went back and then she called me and said, hey, I can look down a bit more. Then I said, yay, good for you. Then after 5 visits, she can totally do this right now without any issue. So
Okay.
I'm glad to hear that that
So do you
we
think
help her.
the dizziness is due to what cause? It's because of that lah, misalignment, is it?
Yes, this is due to the skull. This is not the C1. This is the
Okay.
skull.
Scalp lah. Mm.
Yeah.
Okay.
Okay, so it's still up here. It's
Mm.
still up here. It's
Just
still
now
up.
got one audience asking, is that X-ray is needed before the vertigo treatment? Amanda.
Okay, Amanda, we will need to check first. You can come in and for consultation, and then we will need to check first. It's not like, oh, okay, I send you to X-ray first lah, everything X-ray first lah, and then yes, you need to come in first. We need to consult you. We need to check is it the vertigo that we can help, or
Mm.
it's a more central one, or it's because of something else, or because of bacterial infection. We don't know. We need to like really check it out first. I hope
Okay.
that I answer your question. Don't go take X-ray by yourself because what we need is totally different.
Yeah.
Okay, and this one, yes, a left side. Can you see this? A big gap again around this part.
Okay. Yeah.
Okay. When he comes in, he also said, "Wow, vertigo is also my old friend. I need to get MC. I need to go on leave
Mm.
until I can get down from the bed, and I can only sleep one side." Then I'm like, "Okay, understood." And then when he comes in, he's like that. Then I asked him, "Hey, do you know your head is sengit? It's tilting quite a lot." Then he said, what I see is not tilted. What I see is like normal. But I don't know why a lot of people say my head is tilted. Especially when I take picture, my head is like that." Then I said, yes. When you take this X-ray, his head also like that. Can you see
Okay.
that? Yes. This is because of the misalignment up here, and
Mm.
also from down here. These
Mm.
two places. And
Mm.
then when I first adjusted the C1 like back in, it's very loud also. Then he's like, wow, is my neck still there? Is my head still there? I said, yeah, your neck is still there. Your head is still on top of the neck. Don't worry. Then after adjusted, he felt a big, like the tinnitus, the ring, like very long. Then I said,
Tinnitus.
yeah. Then he felt that. Then he told me, I said, do you feel that normally? He said no. Then I'm like, okay, never mind. Walk
Mm.
around first. Then after he walks around, then the tinnitus slowly calm down. Then he cannot hear that anymore. So it's like a longkang full of rubbish, water cannot pass. When I dug up all the rubbish, water suddenly flow very fast. And sometimes it will flow to spill out, water will spill out because flow too fast. Same. When I
Okay.
like reduce the nerve impingement, signals start to flow very fast. Therefore, he get the tinnitus, like ringing so loud. And then when body start adapting, and then your body is like, wow, I scared suddenly. And then when your hormones start to calm down, the ringing reduced.
Okay. Interesting.
Yes, I know this is very new for a lot of people, but we
Yeah.
do encounter all this a lot. Mm.
Mm.
Same.
Okay.
We need to check first before
Okay.
accepting.
So meaning this person is actually present with the dizziness or vertigo.
Vertigo. This is not dizziness. This is really
So,
with
but this is a long term vertigo case for
yeah.
research.
It's a chronic,
Long
very
term
chronic ones.
chronic. I see.
Mm.
But after that, what happened? Is it the vertigo is totally cured or is it improved?
When he has this part pain, the vertigo will come back a bit, but it's not as
Ah,
bad as last time.
I
Same or
see.
don't need medication anymore, and his head is coming back already.
Okay. All
It's not
right.
so sengek anymore.
But he has been singing for many years, is it?
Many years.
Wow. Yeah, I do sometimes I remember last time when I drove back my hometown, then I saw a person, he walking like this one, you know. I said, huh, why the person the head like this one? It's like all the
I
while whatever
yeah,
action also this one, you know.
that one I think it's a bit different. That one might be a torticollis. It's another thing already.
Yeah,
If you have a upper cervical problem, it will tilt, but it wouldn't tilt so much.
I see.
Yeah, it
Okay.
wouldn't tilt so much.
Okay,
Mhm.
so over here we are open for Q&A. See whether any questions from the audience. If let's say you have questions, feel free to type your questions. If not, then we are very thankful. Kyle, you join us today for tonight, and I can see that over here actually your Facebook Live from the ASAP audience are even more than Sound Live. So I believe your how to say your followers would love to listen to you all more to do more Facebook Live, right?
Mm,
So yeah, that is a sharing. It's a very good sharing, and thank you for your valuable times on Sunday night to share with us about this vertigo causes and treatment, especially the treatment way coming from the chiropractor perspective. So spine
yeah.
health is very important. I
Mhm.
myself also visited his clinic, so I would like to also encourage for those like if let's say you don't have problem, can always also use this chance to actually WhatsApp
No more.
Spine Health to this number. The first 10 who WhatsApp, you actually can use 16 ringgit to purchase a chiropractic consultation worth 70 ringgit. Okay, so this is a promotion that we are giving out tonight. And not only that, Sound Life is also giving out something whereby we are giving out 3 voucher for here to do hearing test. So those who WhatsApp Vertigo to this number 01056366687, you can actually entitle the first 3 who WhatsApp to this number, you are entitled sharing test voucher worth 100 ringgit, whereby we can do it online consultation for 1 hour or we do it offline. You come to our clinic, then it's totally FOC. Okay, so hopefully tonight sharing can benefit from some for some of you, and then any last word for the audience, Kyle?
Mm, feel free to check your spine, not only for vertigo, dizziness, and everything. we do treat a lot of other things like low back issue, numbness, tingling, neck pain, headache, shoulder issue, wrist, ankle, knee, every single thing that you can name it. But don't ask me to do something weird lah. That without the bone or anything, that one I cannot help.
Yeah, correct. Yes. Okay. So I see from the comment box there is no questions from the audience. So over here we like to thank for your time. So now it's 10:16.
Yeah, need to go back
Okay.
sleep.
Yeah, we have to go back. So that's all for tonight. Thank you so much for your time. Goodbye. Say good night.
Good night.
Good night. Bye bye.